Good evening, everyone. My name is Dr. Blessy Sehgal Bhalla. I am a consultant nephrologist at Sri Akshan Balaji Medical Institute, Paschim Bihar, New Delhi. So as we all know, that chronic kidney disease or kidney disease is an ongoing and an emerging epidemic in India as well as worldwide. So this year, the World Kidney Day theme has been kept as Kidney Disease Health for All and preparing for the unforeseen and thinking about the most vulnerable. So in case of emergencies, that could be man-made or natural, like the unexpected epidemic of COVID, flu, wars, earthquake, and flood. It is the people who are living with chronic diseases, especially chronic kidney disease are the people who are worst affected, because these are the people who need continuous and lifelong care, and most of them have complicated issues. So these are the people who are most vulnerable. And what I would suggest is, as well as the World Kidney Organization have been suggesting, that the government and the healthcare industry, as well as the policymakers and the people living with these conditions, should be prepared to deal with such unexpected problems so that they can have a healthy life in case an emergency exists. The other set of people are, we have to be prepared for the people who are most vulnerable. Now, who are these people who are most vulnerable? These are the people who have diabetes, who have underlying hypertension, who are old age, who have underlying heart disease. These are and obese people. These are the people who are most vulnerable to develop chronic kidney disease. Worldwide data suggests that the people are diagnosed very late with CKD or kidney disease. About 60% of people do not know that they have kidney disease. They are diagnosed in stage 3 or above. That is when their kidney function drops down to less than 45 to 60 ml per 16 ml per minute. So late diagnosis leads on to more complications, more number of people dying of complications, more number of people going on to further dialysis or kidney transplants. So what I would suggest is, we have to start screening these patients, this vulnerable group, early, and we have to pick up and diagnose early so that they can, proper treatment can be instituted. So how do we screen? This is for public awareness. How do we screen? Now, screening is very easy. We have to just do a blood test, or we have to do a urine test. So in urine, we have to see how much of protein is leaking in the urine, and in the blood, we can do creatinine levels. So from which we can estimate the eGFR, the glomerular filtration rate. So both these tests are easily available and should be done at regular basis, especially in this high-risk population. And it is very cheap, around 200 to 300 rupees. In 200 to 300 rupees, these two tests can be done. So we have to do these tests regularly in this high-risk group. Patients have to be picked up early and referred and properly treated. Other thing is, for general population, a healthy lifestyle has to be instituted. We have to control our sugars. We have to control our hypertension. We have to control our salt intake. We should not be smoking. We should not curtail our salt as well as our alcohol intake. Regular exercise is needed, and a healthy lifestyle has to be instituted. So with all these things, the incidence of kidney disease can be kept low. And if you have kidney disease, please regularly get a regular checkup done, control your blood pressure, go to a proper doctor and a nephrologist, and take treatment at an early stage and proper treatment, and adhere to the treatment so that we can avoid or at least postpone the starting of dialysis or transplant. That is all. Thank you.